this is Dr. Rob. The purpose of this video is to show you how I want to get you better, and not just pain-free, but just also how to stay well. That's the real trick in life nowadays. Not only do we want to feel good, but we should also be healthy for the long term, and that's what I want for my patients. So we're going to show you how we do that at Murray Family Chiropractic. The problem is the world is putting so much pressure on us nowadays. We sit way too much, we're in front of technology all of the time, and there's so much stress in our lives. And accumulatively, that is breaking us down and is putting us in a very vulnerable position with our health, causing pain, illness, it's degenerating our spine, and so we need to get out of this rut. And that's what we like to do at Murray Family Chiropractic, is show you how to get out of that rut, get your health back, and not just feel well, but be healthy from the inside out. So let's get started. Number one, we need to understand what the spine is and how it works. So when you look at your spine, there's a few important things we need to understand about it. There's different regions to the spine. We have the neck, which is the cervical spine. We have the mid-back, which is the thoracic spine. And we have the low back area, which is the lumbar sacral area of the spine. The spine has a specific shape to it. As you notice that the spine, when you look at it from front to back, should be perfectly straight. And when you look at the spine from the side, it has a forward curve in the neck, a reverse curve in the mid-back, and a forward curve again in the low back. Around the spine, we have your nerves that exit, and these nerves are vitally important. If there's one connection I want you to understand, is that your spine has an intimate relationship with your nervous system, and your nervous system is the master control system for your overall health. We need your nervous system to be functioning at its best ability for you to be able to heal properly, feel better, and stay better. So we have your brain up here, and your brain is connected to the rest of your body by your spinal cord and all these nerves that come off the spinal cord. These nerves exit the spine in between all of your vertebrae all the way up and down your spine. And all of these different nerves go to different organs and tissues in your body. Every nerve controls different organs and different tissues. And there's a constant flow of communication from your brain down through your spinal cord, out through the nerves to your muscles and to your organs, telling your body how to function properly, how to heal properly, and how to recover from injury and regenerate new cells. This system is vitally important for your overall health, and the world we are living in nowadays is putting tons of stress on our spine. When we sit in front of computers, we tend to slouch, look down at the laptops, screens. When you sit in general, your low back flattens out, and we lose that natural curve in the low back, which is not good either. So we're putting a lot of stress on our spines. Our spine protects our nervous system. Your nervous system is the major master control system for your body, and so we need to take care of all this in order to get you better. Different areas of the spine can actually have different effects on your health. A lot of patients come in and they'll be suffering from headaches, neck pain, tension, numbness, tingling in the arms and their fingers. These symptoms can all arise from the neck area. Other patients will come in and they'll have tension in their shoulders, shortness of breath, chest pain, vulnerability to asthma, other breathing conditions. These symptoms can arise from the upper back, the thoracic spine area. Other patients mention when they're under care that they notice improvements with constipation, bloating, just not having to get up in the middle of the night and go pee anymore. These conditions can arise from the lower back area, upper lower back area as well. And then other patients will mention that their sciatica gets better, that sharp electrical pain that goes down the leg, which is horrible, or numbness in their toes will go away, obviously low back pain going away. These issues can arise from the lumbar spine where the nerves are coming out, feeding the organs and the muscles into your legs. Okay, let's take a look at how damage can show up in your x-rays. What we are looking at is an x-ray of the side view of a person's neck. Notice there is a forward curve to the right, smooth edges to the bones, and in between the front of the bones there's thick black spaces where the discs are. Over the years of damage caused by overuse of technology, repetitive work habits, or maybe even possible history of trauma, the spine can alter in its shape and posture, and the curve can be reduced. This is called phase 1 of spinal degeneration. When people have phase 1 of spinal degeneration, they can experience headaches, neck pain, shoulder pains, and a wide range of other symptoms, because not only are the muscles and bones involved, but also your spinal cord and nerves are involved as well. Unfortunately, we are seeing this happen at an accelerated pace due to the overuse of technology recently. And it's not just happening in adults. We are seeing lots of children coming into our office now who are already in phase 1 of spinal degeneration, even at the young age of 10 years old. Why is this happening? It's because kids are now growing up playing on devices from the ages of 2 or 3. Because of this, it's led me to start a program in our office where when the first family member arrives for an exam in our office, we extend free exams to the remaining family members with absolutely no obligation to begin care. These exams can also be extended to coworkers or friends that you care about. Why would we do this? It's because too many people are possibly suffering with spinal degeneration and they don't even know it because they don't have symptoms yet. You just don't know how healthy your spine is until you get an x-ray. So don't be shy to take us up on this offer. There's absolutely no obligation to do care. Okay, let's get back to the spine. If phase 1 is left untreated, people will progress into phase 2. In phase 2, we see bone spurs forming, which are sharp, bony protrusions on the edges of the bones. And the discs can now degenerate, bulge, or herniate as they have way too much pressure on them. Now patients will experience more severe symptoms. In phase 3, we see an advanced amount of degeneration that's spreading to multiple bones. In some cases, bones even fuse together. These are generally patients who are older than the age of 60. But again, with the acceleration of spinal degeneration, we're seeing this happen at even younger ages. And these patients have severe neurological compromise and lots of physical pain. This is something that can be totally prevented with corrective chiropractic care. And research is showing now that in phase 1, where we alter our posture and we lose curvature in the neck, that loss of the normal curve actually stretches the spinal cord and starts to irritate your nervous system. And people can start developing symptoms of neck pain, tension, numbness in the hands and fingers. But at the same time, it can be a little sneaky. Sometimes your body doesn't always create symptoms. There aren't always those warning signs. And so we recommend proactive checkups. And as we learn more about the human spine and how it's working, it makes sense just to get your spine checked, just like we get our teeth checked. Now, if phase 1 is left untreated, the wear and tear on the spine will get worse over time. And in this phase 2 x-ray, we're starting to see bone spurs developing on the bones. They're getting pointy, rough edges on them. And the disc spaces that were once nice and thick, like this one, are now thinning out and getting degenerated. And when they thin out, there is a possibility that a disc can herniate or bulge and put even more pressure on the nerves around the spine. So this is not a great situation. Many people who are in phase 2 are taking medications because they're in so much pain. They need relief. They're looking for answers. But the medications, unfortunately, are not solving this problem. And so we need to get people checked, under care, and start undoing the damage. The beautiful thing about chiropractic care is over the years, as we've refined our techniques and made improvements within the profession, we actually have the ability now to stop and correct degeneration in the spine. We can prevent it from getting worse, and we can also undo some of the damage. Patients can come in and they can see x-rays that show improvement over time, with curvature coming back into the spine, disc spaces regenerating and getting healthier again. So there's been some really amazing breakthroughs with chiropractic care, with corrective type care, where you can actually make improvements on the spine and undo damage, aside from traditional chiropractic care, which has always been about realigning the individual misalignments that develop in the spine. So now we take care of all that. We take care of the individual misalignments, but we also take care of the global postural changes and any degenerative effects that are happening in the spine. And this has been a huge breakthrough in chiropractic care. Being able to do this has allowed us to get patients so much better over the years. I've been able to help patients over the last 12 years with conditions that I weren't able to help people with in my first 6 years of practice. and it's been an absolute blessing. A lot of patients will start feeling better within their care with our office in the first 2 weeks to 2 months. But if we want to see true correction and stabilization of your spine to a point where you're going to do better for the long term, that could take upwards 12 months of care. And a lot of our patients, once they are corrected and they've been feeling better for a while and they see the changes on their x-rays, they feel how they are different, a lot of patients opt to do wellness care in the future and come in for routine tune-ups. But that's a discussion for later on. Right now, we just want to figure out how can we get you better and what is it going to take. So what is our game plan for you? There's 3 things that we need to do to get you, 1, feeling better, and 2, stabilized and correcting. So the first thing we need to do, obviously, is our chiropractic adjustments. Our adjustments have become really advanced over the years. Our techniques are so gentle, it's comfortable for everybody. I adjust newborn infants, I adjust elderly people with osteoporosis, and all of our techniques and approaches are extremely gentle. The second thing we need to do is we need to get some home exercises going. But the good news here is that these exercises are different than gym exercises. I know people often start to sweat and panic when I say exercise. Sometimes it's a little hard to get motivated to do exercises, but these are easy, anybody can do them. They're made for where you are at, and you'll be able to handle these well, and they should only take you 5 to 10 minutes when you do it, and you should only have to do them about 3 times a week. And these exercises from the videos will show you how to improve the muscles around your spine, to improve your posture, hold you in a better position to help prevent you from getting out of alignment in the first place, and to stabilize your spine. The exercises are really important. And the third component is home traction. And this is one thing that really separates chiropractic care, specifically chiropractic corrective care, from traditional chiropractic care and from physiotherapy and so on. We're going to end up giving you some stretching blocks that you can take home. They're pieces of foam that come in different shapes and sizes, and when you lay on these blocks for a few minutes a day, they will stretch your spine in a manner that we can't stretch ourselves in order to change the ligaments and muscles around your spine so you can regain normal curvature and upright posture again. If we don't use these traction blocks, it becomes really difficult to make corrective changes in the spine. But when we combine the traction blocks with the home exercises and your in-office chiropractic adjustments, that's when the real magic happens. Our patients get better faster, they see better results. That is the game plan. And of course, anytime you're in the office, we can answer questions and help you out and make sure you're always staying on track. And when you're under care with me, be prepared. I'm not just your chiropractor, I'm going to be your coach. I'm going to be asking you if you're doing your homework, and I'm going to be keeping on top of you so you can get the best possible results. Now, over the years of doing chiropractic corrective care, I've noticed there's 4 common challenges that people tend to have. The first question that people usually have is it going to hurt? The treatment itself is very gentle, but how are you going to feel after your first couple treatments? And for some people, I'll be honest with you, they do get a little bit sore. It's not very common, but some patients will wake up the next morning after their first adjustment and have a little bit of stiffness or soreness in areas that are not used to having soreness, because we're getting your spine to move differently, different muscles are kicking into gear, and that's just part of the healing process. For most people, if you experience this, this will wear off within the first week to 2 weeks, and most patients don't notice it after their first adjustment. And you might not even notice anything like that. You might start feeling better right from the get-go. I notice for most patients though, usually their symptomatic improvement tends to be a slow, gradual increase as we go along, and in the first couple appointments you might not notice anything. The second thing that I notice for some patients is that they're just not into corrective care. They come into our office and they understand what we do, they learn about how we work to correct the spine over time, and that's just not for them, and that's okay. You know, if you just want to get a few appointments and get out of pain, you know, that's not something that I want to provide for my patients, because I truly want to correct people and get you better for the long term. But I'm more than willing to refer you to another chiropractic clinic in town that specializes in symptomatic type care. There are those offices out there and they're really good at it, and I'm happy to refer you to a clinic that does that. For me, I want to work with my patients to get correction and to get you better for the long term. The third thing I notice in terms of challenges is time. Life is busy. Life is busy. Maybe my schedule does not coordinate with your schedule as well as it needs to for you to be able to get in for the appointments. The appointments themselves are actually quite quick. Doesn't take very long to adjust the spine. You're in my office, we get you on the table, 3 to 5 minutes of treatment on the table, answer your questions, give you a pat on the back, and that's it. You should typically be in and out of our office within 15 minutes when you come for your regular adjustments. But maybe you have to drive an hour to get here, and maybe that doesn't work for you. We do have patients that come to our office from Toronto, from Barrie, and they can make it work, but not everybody can do that. So if time is a major constriction, we'll see if we can work with you with our hours. We are pretty flexible. We start at 7:30 in the morning. We go to 6:30 at night with our appointments. So usually we can fit most people in. We even have lunchtime hours. And the fourth thing that can throw people off is finances. Sometimes people have a hard time finding the finances to just do care. One of my policies in my office is that I will never turn away a patient who has financial difficulty from receiving care in my office. I will turn away a patient from care in my office if they just don't seem interested or if they're not emotionally or mentally invested in their care. But if you want to get better, I am willing to work with you to find a method of payment and finance that works for you. So in terms of finances, we make it as easy as possible for people. A lot of our care plans that I recommend for patients run anywhere from 6 months to 12 months. And care plans could cost anywhere from someone who's in phase 2 needing lots of care around $2,000. Maybe it's around $1,000 for another patient who's in phase 1. Sometimes a care plan can be as small as $500 to get feeling better, corrected, and stabilized. What we do for everybody who comes into our office is we offer payment options that try to make your options as flexible as possible. You can run a tab in our office and we can keep your credit card on profile and do a monthly tab for you. We can do monthly payments if you like to spread out your payments and pay in bits. Or if you like to save money, patients have asked in the past if they could pay up front and get a discount. And on top of those discounts, as we promote family care, we offer family discounts, we offer senior discounts, and student discounts. So we find that our care is very affordable for many people. But if this needs or warrants a separate discussion, I'm always here for you, and I'm happy to do that. Now, in regards to your next appointment, so when you come in for the next appointment, we're going to review your results. I'm going to show you your x-rays, talk about the tests that we did when we looked at your alignment, your flexibility, and we're going to look at your x-rays to see how much damage is in your spine. Are you a phase 1? Are you phase 2? Are you normal, no degeneration, but you have misalignments that are causing nerve pressure and issues? So we'll go over all of that, and I'll let you know what's going on and how chiropractic care can help you out. I'll show you your care plan. I'll let you know what we need to do, how many months of care, how much that would cost, and we'll go over all of your options, and I'll answer all of your questions. And at that point, once you feel comfortable and you have a good understanding of what's going on, you're happy with the care plan, we can do your first adjustment. Also going to send you a few emails in the beginning of your care that talks about whether you should be using ice or heat, what it's like to start care, things that can pop up, and just some tips for you to get better. Last thing I want to mention is that when you come for the next appointment, I highly recommend bringing a guest. There's going to be a lot of information, and sometimes there's so much information that some of it can get lost, and you go home and you try to tell your family or significant other what was happening at the office, and sometimes it's hard to remember everything. And in the past, I've noticed that when our patients bring their significant other or a support person with them, they just tend to be on board more, and you get more support at home when your loved ones or family members understand what's going on here. So I highly recommend to bring a guest with you to the next appointment, and we look forward to meeting them as well. So I hope you've enjoyed this video. I hope you found it informative. I hope it's answered some of the questions that you might have already going into the next appointment now that we're done your exam. And I look forward to seeing you at the next appointment where I can review your results with you and get your care started. Have a great day.